TAVR is Transcatheter Aortic Valve Replacement, which is a completely disruptive procedure that offers the benefits of aortic valve replacement to tens of thousands or even hundreds of thousands of patients who it wasn't previously available to. The TAVR procedure has actually been performed more than 1.5 million times worldwide with truly excellent outcomes. In about 99% of patients, it's just a puncture in the groin. We don't stop the heart. We don't cut out the old valve. We actually put the new valve inside the existing valve. The procedure takes about 30 minutes to an hour. All of our patients stay overnight, but about 90% of our patients go home the following day. Patients frequently ask about the need for cardiac rehab after the TAVR procedure. What I tell patients is if they come from home, they should expect to go home after the procedure. In fact, in most cases, they'll feel better. And so if they were living independently prior to the procedure, they should be able to continue on with their lives in a similar way.